Rolling on, very special day here on the Big Biz Show, live from the Loft 100 studios. Hope you guys are having a great day wherever you're watching, wherever you are listening. We always appreciate you being along for the ride. I am Costa. That lady right there in the brown is Mary Burt Godwin, and of course, Sully.
Great episode. We got Kirk Huntsman once again from Vivos Therapeutics, stock symbol VVOS, and of course Vivos.com. Dr. Bahar Ismaili, the Vice President of Clinical Integration. And we're talking about obstructive sleep apnea again. And the reason we're talking about it is because not only it's an interesting company to follow in terms of for Big Biz Show, but we started talking about this, and suddenly the network called up and said, we got 1 million emails coming back on what is this. I bet that happens to you every time.
It really does.
When you start talking about it, say, oh, wait a minute. Because I see the light bulb come off in her, right the first time you were on, especially we're talking to a pediatrician, we're talking to a cardiologist.
Yeah.
We have a practicing dentist who now doesn't practice dentistry because she's now an airway architect, as she puts herself.
Right.
Talk about what we're about to see here, because it's pretty exciting.
I am so excited for this next segment. So we have at Vivos an 18,000 square foot training and treatment facility in Denver, Colorado, right at the foothills of the Rocky Mountains. And patients are now discovering that Vivos has something unique and something different. And they're flying in from all around the world to be treated by Dr. Ismaili and other Vivos doctors in our technology. Patients who have not been able to breathe for years, who've been suffering and have really traveled the world over to find solutions. And so we have a patient here, one of our favorite guys. And he's coming to us today from England, where he lives, and he found Bahar online and made his way to Colorado. You put him through treatment, and the rest is history. But we want to hear from him and you today about that.
Yeah, this is a really cool patient. Makes me excited to have him here, Sully, because what Stephen has to share is a common story of average patient. The only difference is he was actively looking for what he found here, but most people don't. So I'm hoping that we can bring that over and just see where his journey started and why he's here.
Let's bring up Stephen Mckay. Stephen, how are you? Welcome to the show.
Hello.
Okay, look, he looks familiar, doesn't he?
Yeah, he does.
This is the picture of the. So let me ask you something. First of all, you look like a completely different person. Do you feel like a different person?
I feel so much better, yes. It took me a long time to find the answers I needed, but finally I'm on the right track. So, living the dream.
How did you, first of all, before we get to what the treatment was like, how did you find Vivos? Was this just a matter of conducting due diligence online and taking your symptoms and cross-tabbing with what you could find out there to solve it?
No, I actually had to get the details via some physical therapists that I was working with to try and restore my health. Over the years, I've had a few injuries playing sport, and I've had a lot of problems sleeping and breathing, and so I tried to fix my problems with physical therapy alone, but then I was given Dr. Ismaili's details because she can work with the mouth and the upper airway and different things like that. So she's been able to fast track my progress.
Stephen, love your Italian accent, by the way. It's somebody who suffers and is going down the path with Vivos, and I'm so excited, and I'm sure you're like me, that anytime now the conversation comes up about sleep apnea, I'm grabbing people and saying, no, stop. Vivos.com, Vivos, let me take you there. How brutal were your night's sleep though before they helped you change, and how tired were you the day after normally?
Oh, I had a lot of problems sleeping. Waking up during the night was the biggest problem. Waking up, gasping for air.
Yep.
In fact, I almost ended up in the emergency department a few times because it was getting quite serious.
What I wanted to go ahead, continue, Stephen.
Not very many doctors knew what was going on, to be completely honest. And I feel like it's a topic that a lot of doctors don't want to really discuss because it's out of their scope of expertise.
So how did it work? How did it start with him?
Well, the fact is, Stephen started with bicuspid extraction, which nobody actually looked at. So they had to remove 2 upper teeth, permanent upper teeth, for orthodontic purposes when he was 10 years old. And by far, his life turned around. As a child, reports go back. And his everything's exacerbated when he was 21 years old. One concussion and his body just completely going backwards.
Yeah.
And for 10 years, nobody's really looking and saying, where did it all start? A dentist got him into a trouble that now he's limping along. His breathing got dysfunctional, his sleeping and his posture. So he goes to all those people to address them in an individual way, in a silo. Nobody has the global picture. And when I looked at him, like I said, that nail in the forehead was there. When you have a crooked nose, you have a crooked spine, you have a crooked pelvis, you have a crooked everything. And you're in a pretzel, for lack of a better term. And we just had to untwist that pretzel, and it doesn't take too long because body is pretty smart. Obviously, you guys can see that he's pretty smart.
And Kirk, this device does that, correct?
Yeah.
Well, the device with the adjunctive therapies that we've developed.
Yeah,
So
really important. It's an important piece of
it's
thinking.
not just, I think if you think about our oral devices as the linchpin that sort of holds everything together. So we can deploy chiropractic, we can deploy oral myofunctional therapy, any number of what we call adjunctive therapies. They all do something good, but it doesn't hold together without the oral appliance. And that's what makes it central to us to have this device.
Because sometimes when you do this, you bring in a cardiologist, or you bring in a chiropractor, or you bring in a pediatrician or a sleep therapist, and so on and so forth, right?
Right, that's right. And we're the only people that have ever published in major medical journals the ability to resolve sleep apnea. Everybody else is managing this condition.
Right.
So the attempt of CPAP, the intent of it is to manage that condition until you die.
Right.
Here's your Band-Aid.
Here's your Band-Aid until you die. What we're
So
trying
is
to do
MAD
is deal
devices,
with
by
the
the way.
root cause.
Say again?
Same as MAD devices, the traditional MAD options or surgical treatments, they're just meant to keep him in that state till, like you said, that shoe drops.
Yeah, a MAD device is a mandibular advancement device. It's your typical oral appliance. It's not what we do,
Right.
but that's the typical.
Hey, Stephen, talk about the therapy itself. What was it like? What was the journey like?
Well, I'm not long into it. I think I'm about 6 months in, and it's been wonderful so far, especially making that trip over to Colorado to the Rocky Mountains. There's plenty to do over there, and you know, the folks over there at Vivos are very welcoming, and yeah, I feel like a special guest over there for sure. The journey so far has been very comfortable compared to other experiences I've had with upper airway management. I wouldn't even call it management. I would say it was an attempt to manage it, but my experience over at Vivos has been 5 stars. So
When you put the device in originally, was it as simple as we've been discussing here? You use the device after dinner, you sleep in it overnight, and that's it. And little by little, I mean, after 6 months, you look completely different. I mean, your nose is completely straight, your jaw is straight. I mean, it's easy to see the pictures. I mean, was it painful? Was it inconvenient? Talk about that.
It looks like it could have been painful from the pictures there, but absolutely not. No. For me, I just felt subtle changes, and I definitely felt some weird things going on in my face, and especially around my temples. But it was sporadic, and the thing is, my body just changed whenever it decided it was ready to, and thankfully, the appliance, it was always there to take up the slack if I wanted to go to the gym and, you know, do some exercise or lift weights, or, you know, I definitely didn't lose any progress. It was always in there, pushing that force that I needed for the changes to occur. So
Guys, as your mouth changes during this process, do you change the oral device to where you know?
There's adjustments. It's adjustable. Okay. So as we make changes in the way that the teeth fit together, sure, it adjusts to accommodate that. Right. What he hasn't said to you yet is he spent a decade of his life. He's only 30. He spent a decade, traveled all around the world, had treatment in South Korea, had treatment here in the United States, searched everywhere.
Including rapid expansion.
Oh, he went through all kinds of traditional things trying to find a solution. It was only when he found Dr. Bahar and Vivos that he was able to find relief. And that's what we love about his story, because it's rare that you find somebody that goes to that lengths at such a young age and then gets the results, and now he's a huge advocate for it.
So after 6 months of treatment.
No, not even that.
But the long story short, his journey's been 6 months long, including coming and seeing you. But long story short is is he? You think he's halfway through? Do you think he's
Oh
almost
no,
through?
he's about 100% as far as his breathing establishment. Now we have to just now dial the teeth in to make sure that he retains that position, because when you stand on your feet right here and I see you keep shifting your weight, I'm watching you. Watching you. So you basically, your mouth is kind of like shifting you on one side or another. So that pretzel keeps going backwards if you don't, because your feet and your mouth are two ends of your chain. So finishing the teeth might take a while because the teeth need to hold that position, but our appliance does a great job giving body a reference that he needs to breathe into.
Stephen, thanks so much for your time, pal. We want to follow your journey as you go along there. Best of luck to you.
Stephen.
Good stuff.
Appreciate it.
Thank you very
Stephen
much
Mckay.
for having me.
Well, I'll tell you, that's what are you happy now? Are you scared? Are you
Well,
feel better now?
and I was talking with Kirk during break. Think, okay, there's Stephen, and there's a lot of Stephens out in the world that have finally gotten to the end of the rainbow. But think how many people out there don't even know they have it.
Thank
And
you.
then they kind of go, well, what do I do now?
The journey for everyone is different. And honestly, if everyone looks at their own face, if things are not where they're supposed to be, your body is not functioning. That's really the end of it.
Coming up in a second, Aman Singh, doctor, board-certified sleep physician. I'm going to talk about also what's the next step, if there is any, for FDA. The name of the company is Vivos Therapeutics. We got Kirk Huntsman, we got Dr. Bahar Esmaili, and coming up here, Dr. Aman Singh. We're going to talk about your sleep study here. Maybe not your sleep study, but talking about sleep therapy here. Stand by, Big Vision.
You have it.